At this stage, it remains unclear what is the Health Department's way forward in the fight against COVID-19. It's yet to gazette new regulations, despite the current ones coming to an end at midnight. What regulations should the department adopt moving forward? We are joined by health expert Dr Kgosi Letlape. He joins us now from Austin in Texas to discuss this further. Thank you so much for your time, Doctor. We do appreciate it. I think many South Africans are waiting with bated breath to find out what the new kind of norm will be like under the National Health Act with new COVID-19 regulations. There's lots of criticism that the Health Department has literally waited till the very last hour. What is your view on the new COVID regulations and what they should actually look like?
Well, if you look at it, what is in regulations is all the possible actions that were taken in the last 2 years under the emergency authorization in terms of things like restrictions, use of masks, closure of businesses, and all the power to isolate someone that is infected or quarantine them if they cannot self-isolate. So all those issues have been put into the regulations, including testing where it is necessary. And I think the question is, the problem is that with the state of disaster having withdrawn, it is important that regulations should have been published so that if there's any comment from any members of societies or any input, those should be taken, even though the regulations were published and we were all given ample opportunity to comment on the regulations. But what is scary is that without regulations and with the state of disaster withdrawn, how are we going to take measures that may be necessary as the number of infections rise?
And I think this is where a lot of the criticism comes from, Dr. Kgosi Letlape, because many are saying that the Departments of Health have waited till the very last minute. We know that they basically gave themselves almost 7 days, if I'm not mistaken, to consider public comments. And this is possibly why we're seeing this very last minute rush to try and get a response from the department to say, what is the way moving forward? Do you think that the Departments of Health should have given themselves more time to consider public comment and to allow for these regulations to be gazetted under the Health Act and not at the last minute?
I think we have a pressure of time in that there's been quarters of our society that wanted the emergency powers withdrawn and the disaster declaration to be over. And that has happened. But on the other hand, the regulations themselves are voluminous. And as South Africans, we want to be heard. So we just need to understand that the time frames that we have are the time frames that we have. Things have been withdrawn, and we're hoping that within a month, there shouldn't be a gap in terms of how to govern and how to effect public health measures. And there is legitimacy in having a concern where when the disaster ends and regulations are not promulgated, there's a challenge in terms of how to govern and how to control the pandemic.
I want us to maybe explore that angle a little further, Dr. Kgosi. And the reason why I ask this is because many South Africans felt as though they were being controlled under the national state of disaster with the COVID-19 regulations. We know that's lapsing at midnight, and there needs to be a new kind of set of COVID regulations under the National Health Act. Should there be a worrying increase in infection and a new variant that could be dangerous, at least the Department of Health will have a way to control the infection and perhaps get hospitals prepared. But how important is it to at least have some set of COVID-19 regulations should there be a worrying variant or COVID becomes out of control?
It is important. Remember, when you exert emergency powers, you are then allowed in law to take drastic actions that take away choice. If you don't have those emergency powers, you need to have regulations that have been promulgated that are in effect, and you can use those regulations to do the things that you used to do under emergency powers. And it is critical that those be out in the open. And we have to understand as South Africans, when we have a pandemic, when we have a health emergency, there will be actions that will be taken by the authorities. And those actions may include curbing civil liberties. It comes with the theft, it comes with the responsibility, because you are in an emergency situation.
Dr. Kgosi, let me ask you one last question. We do know that at midnight, those transitional measures are going to lapse, and we are expecting the Department of Health to perhaps provide certain clarity moving forward, because come midnight, there won't really be any legal authority to require people to wear masks and to adhere to the current COVID-19 regulations. What do you think is going to happen come midnight if the department does release something, but many people might be sleeping, many people might not be really focusing on the fact that these transitional measures are going to lapse?
I think there will be no void, or there should be no void. So in the absence of a presidential announcement of reinstatement of the emergency, the regulations will need to be promulgated. And whether they are promulgated at midnight or midday, we will then have a mechanism to deal with the pandemic. And once they are promulgated, they will be operational. People might say, why are you promulgating them at night? It would be odd for the ministry or any organ of government to come up with new rules when people are sleeping. So, but even if they do that, those rules will be in operation, will be in effect, and they will have mechanisms to enforce whatever actions they deem necessary to curb the pandemic.
But do you think legally people will want to adhere to regulations that suddenly fall under the National Health Act and were only announced in the last hour or by midnight? Because there's a lot of criticism that the Department of Health has left this till the very last minute, but also that there has been no clear communication, because it would be quite different, Dr. Kgosi, if we had a situation where the Department of Health came out and said, we haven't had enough time to consider public comment. We've only had 7 days. We have legal action, with many criticizing the fact that there's a issue around possible mandatory vaccinations. And why should we consider this? Because there's no longer an emergency and there's no longer a national state of disaster.
Well, the issue of whether there is no longer an emergency or state of disaster, it's a question that depends on the figures that we have. As you alluded at the beginning, the numbers are rising. You must remember that over 2 years ago, in March of 2019, we had a state of emergency and a level 5 alert with lower numbers than what we have right now. There's a lot that we've learned in that 2-year period. But I think what is more alarming and concerning for me is the fact that as South Africans, we don't seem to understand that we're going to take personal responsibility to curb the pandemic. We don't seem to understand that the pandemic is spread by us, human to human, and not by government. The government just comes up with the mechanisms to curb the spread. And we should not be in a position, whether the government comes in or not, we all have the knowledge that says when the numbers go up, avoid unnecessary gathering. If you are indoors, wear a mask for your own protection and the protection of others, not dependent on a law being passed, but just based on the knowledge that we have. Continue with the public measures of hand washing, sanitizing, distancing, avoiding unnecessary gatherings, and all of us will be better for it. We have the knowledge. We don't have to be a law-driven society or things having to come from the courts. That is what is concerning for me as a South African.
Certainly, and it's about each individual taking that responsibility and understanding the severity of a virus like COVID-19. I just want to ask you one last question, Dr. Kgosi Letlape, with regards to the possibility of mandatory vaccines and the very alarming story that's coming out today where Aspen says they might have to close down parts of their plant because there is just no demand for vaccines and people are not getting vaccinated.
I think I'm a medical doctor, and we work on the basis of informed consent. And we need to educate the public so that they consent to whatever is done to them as forms of treatment, procedures, or injections that they need to take. As a professional that takes a Hippocratic oath, we have never worked on mandates, even if we know that what needs to be done is in your best interest. We allow people to refuse life-saving treatment as long as they are making an informed choice. And it is quite sad that because of the way that we've handled the pandemic, because of the way that it has been politicized, there seems to be hesitancy about taking sound medical advice. And I hope there will be efforts to take out the politics out of this health pandemic, take out politicians out of making health pronouncements, that we go back to the health ministry and the healthcare professionals taking their role in terms of informing patients so that, and members of society, so that they can make informed decisions. It is quite sad that we have this low vaccination rate when we know the benefits of vaccines, and we should continue educating and take it back to the normative health sites, those being our clinics, our GP rooms, health facilities, and healthcare professionals in general.
Certainly. I think something you said there was so profound, the fact that we have to educate and let people understand the science behind this and how important vaccines are. And, you know, as much as it's a decision that one needs to make, they also need to be well informed to understand how it could possibly be life-saving. Thank you so much for your time. We really do appreciate it. That was health expert Dr Kgosi Letlape just speaking to us about the COVID regulations that currently stand that are lapsing at midnight, and the health department still not saying anything about a way forward.